And that's why I think it's important to know what these density sizes are. And we can also test that, for example, like I just said, with knowing your triglycerides. So if you're unable to lipoprotein test, what you can do is you can look at your HDL. For men, we want it to be over or at 45 milligrams per deciliter. For women, above 55. Some studies will say above 40 for men, above 50 for women, but that also varies. So when we're looking at the HDL carries the cholesterol out of the arteries, out of the vessels, and to the liver. And then the LDL gets the bad rep because it takes the fats and takes the cholesterol to the cells. It's not that it's bad. It depends on what it's carrying. When we're looking at lab tests for that, you can look at the lipid panel and you can ask for additional lipoprotein test if yours are out of range and you have concern. Levels of triglycerides, what I have read is a good rule of thumb is they should be no more than half of your HDL. So if your HDL is 50, your triglycerides should not be over 100. However, when I was talking about in the last video, when they were looking at the risk of the particle size, the small dense LDL, we had a very increased risk when it was over 150. And so 79.1% of that was the small dense particle sizes, which is increased the risk of cardiovascular disease. Anything over 250 milligrams per deciliter was 100% small LDL particle size. So a good rule of thumb would be less than 150. But now we know with just from that study that it really does depend on the HDL as well as that particle size.